A very important question is, how does risk sharing work at Protera Health? Protera Health is unique in that we're very aggressive with sharing risk with our health plan partners. And we minimize overall risk because we bill in network as a provider. So there's really no administrative fees or PMPM expenses. We take a three-stage approach to risk sharing. Stage one is taking risk on clinical and engagement outcomes. What that means is that we set certain standards for which our patients and members have to achieve with regards to improving from a clinical perspective on pain and function. And if we don't hit those parameters, our fees will be at risk accordingly. We also take risk on engagement and experience scores. So we set net promoter score thresholds that we have to hit in order to guarantee our full fees. That is the first phase, and it's often the easiest phase to start with because the partnership is new and we're still trying to understand the data around costs, baseline costs, and cost projections in the population. As that data comes in, usually over the first 12 to 18 months, we can then construct the second phase of risk sharing, which is a shared savings model. That allows us to set baseline rates and then do a shared savings based on mutually agreeable actuarial assessments. The third phase is a population level risk sharing. Now, to do that, you really have to do phases 1 and 2 fully and in a mutually agreeable way. Then you can take a population level risk. Now, here's the caveat. If you are a payvider and you are part of a health plan that is owned by a health system, it is very hard to do population risk sharing because the health system typically is not able to accommodate a lot of site of service changes because of the surgical settings and the ASC versus the outpatient HOPD rates. Not really important for this video, but the point is that it's hard to do a population-based risk unless you can really optimize site of service and include some utilization management as part of the program. So level 3 or phase 3 population risk is possible, but it's not going to be possible with every single health plan just by the inherent natures of being owned by a health system.